Okay, 65-year-old male here for swelling in the right ankle. No significant discomfort, although he does note a little bit of pain in the retrocalcaneal bursal region with active plantar flexion. We're going to go ahead and just do a quick ultrasound. This x-ray does show some like a loose body within the lateral ankle mortise. I'm not sure if it's actually within the joint. It looks a little bit low to be in the joint, so it might be just within the soft tissue. So we're just going to go ahead and do an ultrasound.
Here we're going to go over a ankle joint injection. This is an in-plane approach. We are essentially trying to get the needle between the tibialis anterior tendon and the extensor hallucis longus tendon. Here you can see the needle going just medial to the dorsalis pedis artery. This depiction, unfortunately, the artery does not go intracapsular, and the fat pad also does not go outside the capsule as well, which this image depicts inaccurately. Here we're going a different approach now. We're trying to slip the needle essentially underneath the tibialis anterior tendon, going right towards the cartilage surface of the talus, but obviously you want to avoid nicking the surface. Also during this approach, you are heading towards the dorsalis pedis artery, so you have to be cognizant of that structure and obviously avoid it, as your needle should be lateral and underneath that structure.
Here's our first clip. We can see that calcific body. It looks like really in the region of the ATFL.
So here we don't really see any continuous fibers of the ATFL, consistent with just about a complete tear of the ATFL. And this patient did admit that he twisted his ankle about a month prior to presentation. So this could be a subacute type of injury with avulsion, perhaps of the distal fibula from the ATFL. Now we're going to look at the ankle joint itself, just part of our exam here. Here you can see the dorsalis pedis artery, essentially underneath the tibialis anterior tendon at this view. You can see the talar dome. Appreciate some of the hyaline cartilage over the dome. You can also appreciate the fat pad within the ankle joint itself. And when you do an injection, you essentially just want to get the needle underneath that fat pad. And you really want to get your needle between the extensor hallucis longus and tibialis anterior tendons, and not through the tendon, which you see here. Now we're going to look at the ankle joint in an axial plane. You can appreciate the dorsalis pedis artery pulsating underneath that tibialis anterior tendon, kind of between the tibialis anterior and the extensor hallucis longus tendon. Also, I believe you can make out the different branches of the deep peroneal nerve here, just under the extensor hallucis longus tendon. Now we're going a little bit distally towards the ankle joint itself, and now we're looking at the talar dome, or the trochlea of the talus. And here you can appreciate again the dorsalis pedis artery. And this is a different technique of doing an injection, where you go from a medial to lateral direction. You're going kind of against the grain of the tendons, but you want to get your needle just above that hyaline cartilage underneath the fat pad. Here I am pushing with my finger just under that tibialis anterior tendon, which is what I do before any injection to get a sense of where the needle is going to head. And now we're going to finish up and just look at an intact anterior inferior tip fib ligament, which you can appreciate here.